Hello, this is June Kirkland-Smith, and I'm with Kristen Williams with the Janeway Lifestyle Program. We are recording a webinar about ADHD and some strategies for coping. The webinar is broken down into two different pieces. The first part will include some descriptions of ADHD, features of ADHD, and some things that you can do to help your child who has ADHD. And the second part is mainly about lifestyle and some of the things that you can do with regard to your child's lifestyle that may help you with their ADHD symptoms. So ADHD has a number of primary characteristics, one being inattention, hyperactivity, impulsivity, and then the combined type. So basically, when we talk about inattention, we're talking about the inability to focus attention, particularly on activities that require sustained mental effort or activities that may not necessarily be enjoyable. When we talk about hyperactivity, we're talking about difficulties with regard to regulating activity level. And impulsivity basically involves the inability to inhibit behavior. There are three subtypes to ADHD: predominantly inattentive, predominantly hyperactive and impulsive, or a combined presentation where children have both hyperactivity, impulsivity, and inattention. Symptoms for a child to be diagnosed with ADHD should be present over about a 6-month period in multiple environments, so they would not necessarily be present just at home, but likely present at school and at home, or maybe in other social settings such as in their sports groups or at their grandparents' house or any other social setting. And the symptoms have to really impair a child's ability to function well, and also must be more exaggerated than most other children their age. About 3 to 5% of children have ADHD worldwide, and this varies from continent to continent. It is typically more common in males than females, although females tend to present more with the inattentive type. It affects all levels of intelligence, so children can be very bright, or also children who may struggle intellectually may have features of ADHD. There's a high likelihood that there may be another psychiatric disorder or a learning disorder. As an example, about half of the kids who have ADHD will also have a learning disorder. Several will have, a quarter or so will have sleep disorders. About 20% may have oppositional defiant disorder, which is characterized by persistent inability to agree and get along, and just an overt defiance with regard to behavior and attitude. And about 12% have anxiety disorders. Kids with ADHD of the combined type will have, with severe impairment, are more likely to present with a comorbidity with some other issue. If your child presents symptoms at a very, very early age, it is most likely that they would have a more severe case of ADHD, but typically people who diagnose ADHD will do so before the age of 12.
So when we consider what inattention and ADHD would look like, you'd likely see someone who has difficulty sustaining attention during tasks, so someone who's easily distracted. They may not seem to be listening when they're spoken to directly. They fail to give close attention to details, or they're often making careless mistakes. Someone who's often forgetful in different activities. They may not be able to follow through on instructions or finish what they start. They tend to have difficulties with organization as well, so difficulty keeping materials in order for school, poor time management, missing deadlines. They're often would be reluctant or avoid engaging in tasks that require sustained mental attention, so in kids, things like homework. And you might also see someone who often loses or misplaces things that they need, so their school materials, their phone, their keys, that kind of thing. So we need to keep in mind when we look at symptoms that they do need to be inconsistent with the person's developmental level. So we wouldn't expect a young child to have excellent organization skills, but that is something you would expect, at an older age that they would be able to keep things somewhat organized. And as June mentioned, for diagnosis, the symptoms do need to be impairing or really negatively impact their functioning. So if you have a child who struggles with some of these symptoms, trying to assist with organization strategies at school and at home can be really helpful. So at school, you could have things like a color coding system. So for example, colored binders for different subjects. They can keep the work separate and kind of organized by color. Use of colored highlighters, again, to have sort of a color coding system. Help your child get in the habit of putting their homework in their book bag right away, not kind of laying it somewhere else. In terms of organization at home, things like labeled bins or baskets can be really helpful. So for example, if you have all the outdoor winter hats and scarves and they're all in one basket, your child knows to kind of, okay, I always put it here and this is where I'll always find it. In terms of school, you would encourage them to really be checking at the end of tests and assignments to make sure they've completed everything, maybe to consider kind of marking up questions on a test once they're completed so they can see what's left. If children do have the diagnosis of ADHD, in some cases accommodations can be put in place at school, and some of those accommodations might involve preferential seating. So you might be better to have a child seated near the front of the room or away from a window so there's just less distraction for them. At home, when making requests, you'd really want to try to break down sort of multi-step requests. So you're really trying to minimize multitask instruction and maybe give one instruction at a time or try to just break things down into smaller steps. Sometimes that can be helpful. We'd also want to try to encourage different interests and activities. So if you have a child who loses attention easily in something, it's important to find something, an activity that they like to do that they enjoy, aside from screen time activities, because that can be really important for self-esteem. And it may just take a little bit more kind of sampling, for them to find something that really kind of keeps them interested. So you can see here, we just have some examples of organization strategies for school and home. So there you can see some color-coded homework boxes as well as kind of color-coded binder system. And then for older children or teens, like use of an agenda or online schedule system that's also color-coded could be helpful. And then you just see there the picture of the room. You can see how things are very labeled and kind of color-coded at home. And just having a set place for everything can make it easier to find things.
So the other feature of hyperactivity in children with ADHD basically involves with children who would fidget and squirm a fair bit. So these would be children who have difficulty sitting still and not being able to control their feet or hands, sometimes wiggling around. They may also run or climb excessively, jump over the last several stairs when going down a stairwell. And they act as though driven by a motor, so they seem to be pretty active most of the time. They may also leave situations where sitting is expected, and this is fairly common in young children when they're expected to do circle time in daycares or in kindergarten or grade 1, or in older children, they may get up and leave the classroom frequently or wish to leave or request to leave on numerous occasions. They may move around constantly and talk excessively. So children with ADHD tend to talk fairly constantly, sometimes have difficulty listening to their peers or other people, and always want to be speaking and kind of controlling the conversation. They also have difficulty playing quietly or relaxing, and their play tends to be rough. Sometimes you might find that children with hyperactivity will be rough with their toys or belongings. They tend to break things more easily, and they have difficulty with quiet, relaxing play, such as doing puzzles or those kinds of activities. So they like to be in motion all of the time. And next we have a little cartoon that depicts a kind of like lady who whose baby was just born, and obviously the kid is pretty active. And we know that anecdotally, many people have reported that their children who are ADHD were actually fairly active even in utero and as very young children. The other thing that's common with children with hyperactivity, which I forgot to mention, is that they may have difficulty settling for sleep. So they may have a long time to settle down at night, and they may also rise fairly early in the morning. Some ways that you can help with hyperactivity is to reduce screen time, because screen time does not use up energy and it has a number of other ill health effects. Children with ADHD are attracted to screen time, but we feel that it's much more effective and healthier for children to walk, hike, bike, play sports, play street hockey, walk to and from school, and move naturally. The body is meant to be moving and be in motion. And when you spend a lot of time sitting using screen time and only moving like your fingers or a control panel, they're not expending any energy. And while we know that kids who are hyperactive are very active all of the time, we know that when they spend a lot of time outdoors or running around or participating in activity, they can at least burn off some of that energy, and if nothing else, it'll help them sleep better. You can also use squeeze balls, have small items in their pockets, or little things that they can play with, which are not too distracting to the rest of the children in the classroom, but can allow the child to acceptably move around or fidget or play with something without disturbing other people. They can also wiggle their legs or sit on a little pillow type thing, which helps them move around as well, but they're not actually moving in a way that would disturb other people or disturb the lessons in the classroom. You can also find acceptable ways for children to be involved in moving, so they can be volunteer for bringing down the lunch order to the office, or run a message to the office, or go to the washroom, every hour or something like that, so that they have a more socially acceptable way to get up and move about. With regard to bedtime, because bedtime is such a difficult issue for children who are hyperactive, having a routine is very crucial. And having a routine that they stick to and become very familiar with, so that they know they can, from this, reduce a lot of the stimuli or other things that would distract them from settling at night. So habits are very helpful, and starting early for a bedtime routine is important. And having activities that children can do if they have to wake up early that are safe and not necessarily screen time can also be helpful.
When we consider what impulsivity in ADHD would look like, you'd likely see someone who has difficulty waiting their turn, so difficulty waiting in line, or waiting when their hand is raised in the class to answer a question. You might see someone who interrupts or intrudes on others, so interrupts when someone is speaking, or they might seem like they kind of just blurt things out loud. And they may start using others' things without asking or without permission. An associated feature of ADHD can be low frustration tolerance and mood lability, so quick changes in mood. So not everyone would experience this, but you would see it more commonly. It might also seem like the person makes decisions or takes actions without always kind of thinking things through. So that idea of kind of sort of acting before really sometimes thinking through the consequences. So how do you help a child who exhibits impulsivity? So for younger children especially, we really need to think about safety. So really trying to be one step ahead, having good safety locks on things, that could be dangerous in the house, making sure to hold hands in a parking lot or near traffic, having good supervision around animals. So prevention is really important if you have a child with high impulsivity. You can also try to practice and help them with things like waiting and turn taking, and you really want to praise or positively reinforce when a child is able to wait or is able to show good respect for safety rules, things like that. Mindfulness is a concept that anyone who's done our core group is familiar with. So it's really about the practice of paying attention on purpose to the present moment and observing what is happening internally and externally. So even younger children can learn to practice mindfulness. And we do have resources on the JLP website for different apps that can help with that. So trying to encourage mindfulness in young children as well. So this ends the first half of our ADHD presentation. And in the second half of the presentation, we'll be looking more at ADHD in relation to different lifestyle behaviors.